I'm Toni Esselin.
And I'm Aimee Bernard.
And we are here to help make it make sense.
This is the podcast that takes complicated science and breaks it down into easy to understand language.
So buckle up, buttercups. You are in for a bumpy ride. Hello, everyone. We are back. With a very, very, very special guest. One of my former classmates in medical school. So this is like a University of Rochester reunion that we're having here. The Rock, right? That's what we call it, right? The Rock. So who we have today is Dr. NanaEfua Afoh-Manin, who is a board-certified emergency medicine physician with a master's in global public health and a disaster medicine from Columbia University. She is a public health advocate and the founder of Shared Harvest Fund. As an innovator and thought leader, she believes that health is a human right and has helped organizations and government agencies design programming and health equity initiatives that close the equity gap by addressing the social and political determinants of health. The COVID-19 pandemic exacerbated health disparities, as we all know, and we've talked about here on this podcast. It has increased the burnout rates in Black and Brown medical professionals. Witnessing this firsthand, Dr. Nana designed Project Resus to resuscitate the medical pipeline and reinforce support around Black, women, and first-generation health professionals through their medical journey. I could go on and on and on, and then we would finish this podcast and we wouldn't talk about anything else but her. So we are going to go ahead and dig in. Welcome, Dr. Nana. We are so excited to have you join Help Make It Make Sense with Dr. Toni and Dr. Aimee.
Yes, welcome.
Well, thank you so much for inviting me to be a part of this love fest for medicine and all things. I think you guys are amazing. Thank you so much. And absolutely right. Stop reading the bio.
Absolutely. All right. Well, we're just going to dig right in, if that's okay. We want to hear about your journey. Tell us about your journey. You started working in this space of eliminating student debt in BIPOC communities, especially in the health provider workforce. And then COVID hit and upset your apple cart, as well as the rest of us. So tell us a little bit about your journey.
Yeah, no, you're absolutely right. I think, everything is my favorite mentor. She doesn't even know she's my mentor, but Oprah always says, life is about, the opportunity when preparation meets planning. And I have been preparing, I think as an organization, we have been preparing for this upset pandemic. As an emergency physician, I've kind of lived through multiple pandemics and seen, a constant rerun of, underserved, underprivileged, under-resourced, underestimated communities just get devastated and wiped out when there's this national crisis, whether it was in Hurricane Katrina, Hurricane Sandy, we keep hearing these stories. And so as a frontline clinician, you're just like, when are we going to learn from our mistakes, And a long time ago, I realized, it doesn't matter what the pandemic is or what the crisis is. It's who the people are. Do they trust what's happening on the ground, what they're hearing on the ground, and how quickly can you mobilize, And a lot of that was taught to me, during the AIDS pandemic. I did a lot of work overseas in much more low resource countries than the US, and seeing how quickly people just mobilize to take care of each other, without the labels, without the names. You just got the stuff done. There was, there's a lot of despair, but at the end of the day, people just got the stuff done. And so I intentionally, with my co-founders, decided that we need to get more people with that same school of thought about just being ready to get it done, getting them in the game. And that's what really Shared Harvest was about, sharing the harvest of our collective resources ahead of time and getting people invested in doing this hard work and also rewarding them for it. And so that student loan relief program was really about matching volunteers who were already doing this amazing work with some opportunities to take that burden off of their back, right? And kind of keep them in the game. And so I think when COVID came in, it was just kind of like product market fit, because we had already mobilized over 350 health providers who were doing work with nonprofits. And then COVID hit, the nonprofits shut down, and they were like, hey, what do we do? Where do we go? How do we help? And we were, just savvy enough with our technology to figure out how to flip it. And we're like, we've been doing it this way. Can we pivot it and use it as a platform to match health providers with these access opportunities so we can get residents real resources in real time? And that's what we did. And since then, we have touched the lives of over 13,000 residents. We created the first community-based task force here in LA, and then use that model to work with the Department of Public Health and to various departments all across the state, to just kind of give them a recipe for mobilizing local communities, especially at the time where communities weren't trusting what they were hearing from their national and city departments. So that was it, and now we're in this space where we are now really looking inward and say, wow, that's a lot of work. People are burnt out, and, the doors are opening, the ER is getting full again, and people are getting back to work, but our workforce is burnt out, So what can we do again to circle back to our original mission and take care of those who are doing the most? And so that's where we are right now in the journey of Shared Harvest.
That is really inspirational. I think that's so amazing. So impressive, all the things I've read about you. It's just unbelievable. Toni, Dr. Toni, may I go off script for a minute?
I would love to see you go off script.
I am wondering, because I think not every single person who will be, of the millions of our listeners, I'm not sure that everyone would be completely up to date on what Shared Harvest is and kind of the mission of Shared Harvest. So would you mind explaining that, just so everyone here is on the same page?
Yeah. So the mission of Shared Harvest is spreading compassion through wellness, service, and relief. For us, that wellness is just caring for others, human beings, making sure both your mental health and your physical health as well. Service is doing the work of being in your community, being present, listening, engaging, and finding out different ways to use your skills, to leverage your skills to support community work. And then relief for us is student debt relief, financial relief. And so that's how we tie in the three principles of Shared Harvest.
That's amazing. And you said you've helped thousands of people already at this point?
Tens of thousands.
Tens of thousands. Wow. Okay. Yeah. No, that's amazing.
It's a team effort. I mean, we've had such an amazing group of people who just jumped on board and was like, I get it, I understand it, let's do it. And it's incredible what a small, mighty team has been able to accomplish.
So it's just along those lines of, the Shared Harvest Fund, if there were people that wanted to get involved, do they have to be part of the medical community, or can anyone volunteer or help? Or, I guess, how are the ways that you get people involved? I run a nonprofit after school science program, so I'm going to learn from you a little bit.
Got frozen just a little bit there. Was I frozen on my side as well, or?
No,
Okay.
Let me repeat. So how do you get people involved in can anyone become part of the team for Shared Harvest Fund, or how do you recruit, or how can people get involved?
Yeah, so initially everyone can be involved, actually. So initially the model was, we had 17 United Nations Sustainable Development Goals. And some people are familiar with it, but basically that's goals that have been set by every country around the world that says we want to make an impact in these areas and we're going to measure it. And so originally our motto was, it doesn't matter what you want to do, as long as we can identify one of these 17 metrics to say, this is the work you're doing, whether it's eliminating poverty, climate change, health and wellness, social justice. You know, we partnered with a variety of nonprofits and then used their needs to create almost like a volunteer, like a job board, but it was for volunteers. And they would match with those opportunities, and then we would track the work that they were doing and offer them what we call our social impact points, right? So at the end of the day, instead of looking at your, your credit rating, you had a social impact score. And that value of the value add you brought to the community is what we were using to say, hey, this is why we should be paying off this person's student debt, because they are just doing amazing work, right? And it's well deserved. And so it's only through the pandemic that, because there was such a large calling for health related providers, that the volunteer pool just shifted to healthcare. But in reality, on the ground, it was everybody, including healthcare providers. You know, we had everybody from the we call Mrs. T, who did the pop-up kitchen, and she was cooking at the pop-ups. You know, we had the DJs who were, you were doing DJs on Insta, came out and did some pop-ups as a DJ. So, you know, there was just so much, and that's what we were all like. It's like a block party experience that we made for the community to have a fresh and different engagement when it came to their health and total well-being. And so the same thing with the volunteers. So now if you go on, you sign up, you set up your profile, you list the social causes you care about and the skills that you have. And then you have the autonomy to decide on what impact of work you want to engage in.
Wow, that is really cool. I love the social impact points. I have a after school science program that I run that's a nonprofit. So I get funding to run it in local elementary schools. But that would be great because I have so many volunteers that come just one time, but I have others that come, 10, 20 times, and giving them like a social impact rating that would be awesome. I love it. That is so cool.
I know. Where do you hear about people who are volunteering actually getting like financial credit for volunteering? It's like such a novel idea. And also like, what a way to help support the work, right? And not feel like you're just martyring yourself all the time, and that you're not putting yourself in a hole for doing work that's actually a vocation, So I think that's,
you said it, Toni, because how many times how do you reward a great volunteer?
Right.
You give them more work to do. Right.
Right. Or you write a letter, right?
You write a letter.
Some people will read, some people won't.
Like, you're head volunteer now, still working for free, but now you're the head volunteer.
Now you're the head volunteer and you got more work. Yeah, now you're running the volunteer program as a volunteer.
Okay, so now none of my volunteers can listen to this. They'll help me running away.
It's wanted to really transform that culture of volunteer where we actually do give some real rewards. You do get some ratings. Of course, we always talk, altruism is such a big thing in this country, but it is interesting where it falls on which group that needs to be more altruistic than others, and that's where the equity belt needs to be tightened up a little bit, because people of color who are constantly mentoring, constantly pushing sweat equity, that stuff doesn't get measured, and that's the stuff that really impacts change and transformative change, that small influences that we have on individuals to really make a difference. So we just wanted to change this. We just wanted to change the game a little bit.
Right. No, I think you're changing it a lot of it. So I'm going to go with a lot of it there.
Yeah, I'm moving to LA soon, and I'll be.
No, you're not.
I'm coming in. No, I'm not, but that would be awesome.
Yeah. So, one of the things that I really care about, and that, you and I have talked a lot about, is about the road to rebuilding trust in our communities. It's something that keeps me up at night and trying to think about how can we do this collectively and as individuals. And so I wanted to know, what do you think is the road to rebuilding trust in our communities?
the number one way to do is just be present. And you can't be present only during the fireworks, right? And I think this is why Shared Harvest really believes in our ethos, our mission, right? Because there are people who are of the community, who love their community, would not leave their community if they had a choice, right? Who are so well connected and have such influence in their respective communities, but for the systems that set us up for us to move away from it to be prosperous, right? And so what we're trying to say here and what builds trust is familiarity, right? It's everything from, you walk in the room, the clinician looks like you're like, whew, okay, that's like half the battle. Whether it's a woman comes in, it's another woman, minority, African American comes in, you already feel that, whew, okay, so the next phase, how are they going to relate to me? Whew, okay, the next phase, and then you really get granular after that, right? But I think we cannot just assume you going into any community thinking you have all the street creds you have because you came out of a hospital with this degree and that degree is going to do anything. And that's not going to happen. And we see it time and time again. And so there's that frustration, and then there's just judgment that doesn't need to be there. So for us, and especially for me, I feel like that this is like my life's calling. That workforce is designed to go back to any community and replenish it, and that's how we build trust.
So, because I am a vaccine advocate and lover of all vaccines,
I don't know if you caught on, but she loves her vaccines.
Yes, I've heard.
I know. I go a little crazy.
It's also convincing.
I brag a little bit about my Band-Aids and whatnot.
So much Band-Aid talk. Band-Aid talk.
I still got to come up with my own line of Band-Aids. But anyways, beyond that, I'm wondering, how do you talk to your communities? How do you talk to patients in your communities about the vaccine fatigue that people are feeling, especially around, I think, the COVID vaccines, but we can even say vaccines in general? Like, how do you do that? Because we want to know the secret sauce.
No, I think there is no secret sauce of being honest. I say,
yeah,
I just want to spread. We just sauce to spread it out. For me, when my patients, when I talk to them, I come in and we're pushing vaccine, we're pushing the booster, and the first thing that they say is, well, people are still getting COVID. I say, you're damn right. This is getting ridiculous. And we start getting into the conversation about why are people still getting COVID? And part of it is just being honest, because the science is not all, black and white. There's a lot of gray. And being able to be very honest about that and allow them to see that honest and vulnerability, like, I don't know, that the key is to keep the conversation going. It's not to get them to do what you want them to do at that moment in time, right? It's to keep the conversation going so they get that, oh, this doctor is not like the other doctors who just telling me what to do, right? So when they get the information that's wrong, or maybe they don't, the first time they're questioning the information, the key is that they've got somebody in their mind to say, okay, let me go run this by Dr. Nana real quick, right? And that it's the second conversations, it's the third conversations that I get them on the win. But it's not me coming in and telling them, this is the agenda, you should do it, and then winning from there. The win is the return, being able to convince them that I am someone that they can come back to for clarification and support, reaffirmation, and then be finally for vaccination.
I love that. I think that's something that and as a PhD, I just talk to people that have questions. Obviously, I'm not with patients like, both of you, but I will have conversations, and I have learned that it is multiple conversations over time, because just one chat is not going to cover it. Like, you need to do it, be patient, you know, answer the questions. But yeah, I agree with you 100%. It's more of a conversation. And then I think, like you said, talking to people, like you're just giving them some facts, and you're not trying to push them one way or the other, just helping them to make decisions that they're comfortable with. So I love hearing that maybe that is the secret sauce.
Well, to that point, I mean, I think that to that point, it's like, you know, Dr. Nana has like infinite energy to do this work, right? Like, she's just like, nothing's gonna stop me. I'm gonna talk until I lose my voice, and then I'm gonna drink some tea and talk again. You know? So it's like, but the thing is that not everybody's built like this, right? And so these are some of the things that we are facing now, where just people are tired. They're, you know, we can survey a bunch of patients, and like, they're the people that they have interacted with haven't mentioned the vaccine again, you know, or they don't talk about it anymore. There's difficulty in integrating it into preventative care, which is like, now we need to shift, right? Like, this is, COVID's not going away, right? Like, it wasn't, you know, we didn't get vaccinated and it got eliminated. That didn't happen. And so COVID is still a thing. And so we still have to talk about it. We still have to try to figure out, you know, how we're going to get folks as protected as possible. And to be honest, you alluded to it in some of the things that you were talking about. People are just exhausted. People are tired. Providers are tired. Nurses are tired. Nurses are quitting in droves. Okay? Nurses are quitting in droves. Okay. Yeah. So, you know, what do we do? How do we rally our humans, right? How do we rally our providers who are just like, listen, you know, I experienced loss. I lost patients, I lost family, I lost friends, right? In all different kinds of loss, like however you want to see loss, whether it's within death, whether it's in moving, whether it's in, you know, however it is that they've experienced loss. Maybe folks have gotten more solitary, right? Because they're just like, I don't want to, I'm just putting myself in a bubble because this world is too crazy, right? So what do we do? How do we actually deal with the fact that not everybody has infinite amount of energy, and people are actually, COVID has actually, we already had a burnout issue in 2019. People were quitting in droves already, right? And then you added this pandemic, it just made things worse. And so how do we recover from this?
You know, but we have to define burnout, right? Because as you said, I have infinite amount of energy for the things that I love, right? You asked me to go and cook. I don't love to cook. You asked me to do things that I can, like to read a term paper and review and grade it. That's not going to happen. But and honestly, when I started Shared Harvest, I was burnt out of the hospital. I was burned out. These are the same patients I'd say I love today. I was burnt out by watching them because I felt at that time in the space that I was in, I couldn't offer them anything more. And I knew they deserved more. But I felt restricted in the hospital to offer them more. And then all of a sudden this light opens up, and I always say, you know, COVID MD, which was the initiative that Shared Harvest started, saved my life because I kept seeing patients that I was knocking myself against the wall, because I couldn't figure out how to help them. And I realized more than just trying to shuffle papers and try to get somebody admitted in the hospital, I had to get out into the community to tell them what I've seen and be available, be accessible, and be part of that the community building part. And so I think the same thing is happening right now with our workforce. Everyone's looking for that stimulus. It's not that they're burnt out from life. They're burnt out from the same old story, same old problems, no clear light at the end of the tunnel or how to change this, right? And then and if you know in your heart, you know, most people going to medicine and going to healthcare aren't doing it because it's like the best way to make money. Because we know there's a lot of different ways, right? The not.
And there's so many other ways.
Some of them start with an iPhone and a YouTube channel.
Okay. You got these influencers on TikTok just making bank, okay?
Right? And TikTok, I'm telling you. So we
I'm
don't
telling
do
you.
that, right? And so there's this desire and drive to do something different to make an impact in the world. And sometimes, unfortunately, some of our companies and where we work don't stimulate us the same way. So I think part of the burnout solution is, again, just keeping it real and honest with people. What do you love? What do you want to change? And let's give you the tools and resources or connect you to the right people who are doing that work. And so when we're thinking about connecting with nonprofits and get individuals nonprofits, we want to get them stimulated, right? It's not just about paying off their student loan. That's like the carrot on the stick. But the real work is like they're working with people who are doing this impact work. And as Aimee said, you're there, like, volunteers, you have this nonprofit. There's a reason why you're doing that nonprofit, right? It's not to supplement the income, right? Yeah. So
Exactly. Yeah, absolutely. Ugh. I know, just listening to you, it makes me tired with all the things that we all, I think, take on because we are trying to, help all the humans around us and, make change, make positive change, around the world and the people around us. So I wanted to shift gears just a tiny bit. So anyone listening may not know this, but our guest is also a recent movie star.
Movie star.
A movie star. And
Star.
I was hoping that we could talk a little bit. You could tell us a little bit about your movie, I Am Not Your Hero, if that's possible.
Yeah. I actually, Dr. Toni is also a movie star. Then, if you're gonna put me in that line, she's got a cameo or two.
Ooh, nice.
Nothing like Dr. Nana, though.
I don't know. I guess I'm gonna have to be in a movie soon to hang here. Oh my. Well, yeah, we'd love to hear about it.
Well, so I Am Not Your Hero is a wonderful, wonderful documentary short that just walks through the life of my co-founder, Dr. Brianna Young, and what she experienced being on frontline as an emergency physician, as a mother, as someone who was dealing with mental health and suicide within her household, and still being able to find a way to show up and be present for her patients. And it's a spinoff to the hero conversations that we heard during COVID in the healthcare workforce, right? Because everyone is saying, oh, healthcare workers are heroes. Congratulations. Let's get you a pizza party, and the reality.
Don't forget the banging of the pans.
Banging of pans. Okay. Which are now calling odor altalgia. That's what
right. Okay.
But so we wanted to kind of play on that to say that there's more to our healthcare workers than what they can do for us, right? But what can we do for them? So they're not just your hero. They are mothers. They are not just your hero. They are individuals who are dealing with mental health themselves, and the film is designed to start that conversation as we shift to look at the workforce and how well and whole are they, and what is the responsibility as our society to help make them whole. And it made everything from financial inequities to emotional well-being, access to just mental health services. Many people don't know that health providers don't have free access to mental health services that are autonomous, that are not, subject to scrutiny by their employer, and that's a big deal. So where are you going to talk about these issues and create these safe spaces for storytelling? So we're excited. We had, I had my first red carpet experience, and that was really good. Ooh, yes, got the whole makeup
right.
Off.
Glam. All glammed up. I love it. I love it. I think though, you touch on such a sensitive topic because I think that I used to be a program director. And, there was so much stigma. There's so much stigma for mental health. and like in our field, not necessarily like, I'm not specifically talking about my program, just in general, like just the fear that a lot of residents have, especially residents of color. I have to tell you, especially residents of color. I feel like there's just this real concern to just suck it all down, you know, and not share what they're going through, because in fear of like, it's going to reveal my performance. It's going to reveal, you know, it's going to come out, you know, I'm going to be blamed for it. You know, if I have a bad day, you know, you know, it's just, it's not something that, even if you could, you know, you can imagine, I tried my best. I wasn't perfect, but I tried my best to be the most, you know, accessible, approachable program director, like, you know, you're safe with me, all of that stuff. And it was like pulling teeth to like really give support to residents who were struggling, you know, because of fear, right? Like just because of fear. It was just, you know, we're not really, we talk a lot about it, and I'm glad that it's out there, but we really are not, we have to do more, is what I want to say. We have to do more in trying to provide support for folks to just be like, look, I'm having a bad day. You know, it's like, I'm having a bad week. I'm having a bad month. Like things are not going well, you know, and I need to be able to take a pause without judgment, without feeling like I'm letting down my coworkers because I can't come to clinic, or I can't come on the floor. Everybody else has to pick up after me. You know what I mean? Like there's everything, we design our system in a way where there's no room for error. And that is what weighs on us, right? And makes it more difficult. So I think you touch on something so important about the fact that like, we also are experiencing what our patients are experiencing. A lot of physicians, clinicians, healthcare workers are going through what patients are going through as well. And they have this job.
Yeah. And what you just said, just telling, it's not my fault, right? It's not my fault that I'm having mental health issues. You done created an environment that is stressing me the heck out, right?
That's
and
right.
So the idea around like individualizing self-care in an institution that requires almost just absolutely desires diversity, intelligence, competence to thrive, it's the institution's responsibility, right? And so we have this conversation, and that's why we are so adamant about changing the discourse. It's an institutionalization of what self-care is, right? The perfect example I can give to you is when I remember coming out of residency, my first few jobs, I was probably one of two, maybe three, if it was a lucky hospital in the emergency room of doctors. And the overnight shift, myself. And I just thought it was what you do. The ER doctor, just 20 beds, you know, the last person's leaving at 2 a.m. You're here from 2 to 6 by yourself, and you're just doing it because you think it's normal, you know, and you just figure out a way to manage the crisis by yourself. And then I moved to California. I joined a very large Permanente group, and I do my first night shift, and there's 7 doctors on. We dropped down to 4. I was like, 4? You know, and you know, the mindset of I have to do this all by myself turned into no. It would be insane for us to keep you here by yourself. We have a staff of 4. So the institution created a system where whatever they had to do, they made it so there were doctors who had support overnight, right? So that's the difference. That's what I mean by shifting the conversation. It's possible. It can be done.
That's right.
The first thing is identifying what is not normal, what is not sustainable, what is causing these crises, and then building systems that are holding themselves accountable to change them and measure that impact, and stop looking at the individual and giving them free coupons to yoga. Like it's not about the yoga. Not about the yoga, guys.
Here's $40 to get a pedicure. You'll feel better.
I love that. Do they have any massage coupons?
You can still give that, but you still got
Or like maybe like a neck, like a massage chair for necks in the back. Like, you get a patient and then like an athlete, once you're off the field, ooh, let me rub you down.
Right after. And I'm still not giving back my Peloton.
I think it's important for us, we get a lot of listeners. This podcast is specifically for like lay people who are not necessarily in healthcare, and so it's important for us. We try to give tips to our community members and our listeners on like how to navigate all of these things. And what's really important is like number one is to recognize that the people that you're meeting to take care of you are also human. Number one. Number two is to, make sure that you're engaged and you're asking your questions, right? Like you're asking your questions, if you're confused about things, if something doesn't make sense, and that you bring somebody along with you so that you're not by yourself and you have somebody advocating for you. Because the system is not perfect. The health system is not perfect. And it's something we've talked a lot about here. And just like you just, expressed, but there are systems that are set up where the security for not only the patient, which is number one, but also for the provider providing the care is also set up. So this is an important conversation so that you as the listener are prepared and are understanding about what it is within your rights to get. You have the right to get a physician, a nurse, a healthcare provider who is not stressed to the max and not loving their job to the max, right? And all of those things. And we need your help. We need the community's help to demand these things, to force these institutions to make these systematic changes so that everyone in every interaction is safe. And is getting the care that they deserve and the care that they want to deliver, because we want to deliver high quality care.
Absolutely.
We want to make sure. I mean, we go into this because we want to save people. It's, we really want to participate in saving you from dying from a premature event, right? Like it's not necessary. This poor guy, I have to tell you, I'm gonna go off script again for a second. I'm so upset about this actor, Lance Reddick, who died of natural causes at 60 years old. Like, what are you talking about? And all of that is just, stress and, not putting yourself first and all of these, like natural causes at 60. I'm sorry. I'm not buying it, but it's a matter of like, we all have to work, Aimee says this all the time. We are a collective society. We are a collective group of human beings. We have to care about each other, and caring about each other is not only just caring about, your family only, but it's also the community of people that are there to help you get through crises, like you were saying, in a way that's not disruptive to your life, So anyway, I hear all of those things that you are saying.
And you're right. There's nothing natural about dying by 60.
Right?
If that's the case, then we got some real looking under the hood on the healthcare system, because we've advanced medicine and clinical opportunity so much. But there is those components of hypertension, diabetes, and why, heart disease. Why is it showing up in certain communities and others? Why is it? What are the indicators and outliers? There's so much to learn, because I just lost my father-in-law, God rest his soul, but he was a badass and he died at 94, but he died of natural causes.
Right.
He after, leading a farm and growing, doing agriculture, and was taking care of his own life, him and his wife, for the last 10 years. They lived by themselves and did everything, played Scrabble, all of that. But there was a different sense of peace that they had, that, not everyone was fortunate enough to have, in their careers and their lives, especially in their retirement.
That's right.
Yeah. I want to reiterate, as a non-MD, but someone who knows a lot, and my husband knows a lot of them, including the two of you, and then also my husband. I just need to reiterate that for anyone listening, your healthcare providers, your doctors, your nurses, they are also human. And when they come home at the end of the day, they also have bad days. So when you go into your providers, you need to be respectful, prepared, understanding that they are also humans, because when those humans go home after encountering, a long day of, probably trying to see more patients and wear more hats than anyone should in one day, they need that compassion. I think that we expect from our healthcare providers, we need to give that back to them. So I just want to reiterate that, because I think that's something that people sometimes forget. I know that I Am Not Your Hero has a lot more kind of meaning than just that, but you guys are heroes in the sense that you are, saving lives and all that, but heroes have feelings too. Heroes are humans. Heroes need to be taken care of, and I just feel like we need to remember that you are also human. And I think some people forget that. So I think that's really important. So thank you guys.
Before you go on there, I just want to like piggyback on there. It's such a tough place, right? Because it's like, the job that you're in and the amount of work that you're doing and expected to do and the perfection that you're supposed to be at with people who are the most vulnerable, right? They're at their most vulnerable. And it's just a matter of like, we haven't done a good job really of like figuring out how can we do this in a way where it's not going to be like, you better do this for me, you better do, like back and forth, right? Like it's not a back and forth, it's a partnership, really. It's a partnership. And how do we foster that partnership between a human being that requires care, who's been through it, right? They're like, all their organs are shutting down and they're, they haven't been talked to nicely by other people in their lives, right? And also had maybe some bad experiences by other physicians or other healthcare providers. And then also the healthcare provider who's been beaten up by patients, and beaten up by the human beings who have been sick too, and like, that needs therapy, like that needs some partnership building and some strategy, honestly, right? Because interfering with. I'm sorry, what were you saying?
The image of I had a case with a patient like literally beaten up. The patient threw the urinal at my provider because he said, "I keep trying to tell you I can't urinate."
Oh.
You keep asking me for an example of urine. That's why I'm here.
Oh, goodness. Oh man. That's like that's real. That's like real, So I think that there's something about, maybe that's one of the things that we need to meditate on a little bit, is like, how can we create the system so that there's like, some kind of built-in therapy between the patient and provider so that everybody is getting what they need out of that interaction,
I think, just to piggyback on what you said, there's a lot of structural issues going on with healthcare, but even that being said, there's a lot of small changes that can happen now, that can improve that relationship. I think, like, just separate yourself from it being a doctor-patient relationship. All relationships the strongest ones are built on trust and vulnerability, right? You share what you know and what you don't know, and you truly believe the person is engaging with you because they care about you, right? Care about your best interest, and what they're saying, what's coming out of your mouth. You have to trust it, right? And I don't think, most patients come into any hospital clinical setting with a sense of distrust when they come in on their terms, right?
Right.
They want to trust what that engagement is. There's something that's going to happen that's going to pull them away, but they've made the step to come in and be part of the relationship. And I think, for just what you said, the structural issues that keep us as a medical society from being vulnerable, right? And letting go when I don't understand this either. or you just told me about something you read online. Uh-oh, I didn't read it, so I'm going to get defensive. No, like so little, just like, you know what? I've not even heard about this drug, but you just educated me. Let me go into my trusted resources and see if I can find a parallel. Right?
That's right.
Right? So that doesn't tell you like you don't know what you're talking about, or it doesn't say I have to know everything right now in order to take care of you. The only thing I need to know to take care of you is what I've heard. You know, have I listened to your concerns, right?
That's right.
Can I articulate what you care most about today? And can I create an action plan and make sure that the follow-up is to your satisfaction, right? But other than that, then it's just building a relationship, you know? It's on building the relationship.
That's right. I love that. I love what you said. That is absolutely true. Just like any relationship. And a lot of the reasons why those relationships don't get built is because of the fragmentation in our system, such that you can go and not see the same person for the same thing, right? Like you're just, you're bouncing around from physician to physician who's just problem solving, right? Or clinician to clinician that's just problem solving, but they're not seeing the whole picture, right? So the best situation is when you're able to like develop that relationship, especially for our folks who are listening who may be chronically ill. Like you need to have that medical home, that place, that person that knows you inside and out, who's been there on your journey, who knows what you've been through, so that you can work together so that you can get to that shared goal, right? That's 100% true. I love what you said there, Dr. Nana.
And one of the nuggets I want to leave for your listeners too is something that I really work hard on is helping patients understand where their resources are. So it's not always like what Toni just said is absolutely right. You want to have that person that knows the total you, but the system of care right now is set up, and not most doctors are going to want to be that person. They are case managers and healthcare advocates that could be that person, right? That know your total story. So when you are engaged with a health provider, you bring that person along like, I'm exhausted. This person has been with me since day one. They can tell you where the last doctor left off. That is a powerful person to have on your side. And don't feel like just because that person isn't your physician or a physician doesn't make them any less powerful, because the power is in the knowledge of their history.
That's
because
right.
you don't deem the situation of repeating stuff and wasting your time and doing things that somebody has already done and not have done the research or looking at what was the outcome for you as an individual.
That's right. Well, that's a great plug for, you need to find a system that has those patient navigators or those family navigators, right? Like, you need to have those community health workers. We talked about this in another podcast, like just having that community connection can save a lot of heartache and pain, so that's a big, humongous plug for making sure that you have some type of advocate around you that knows your story and can speak when you can't. So I love that. Absolutely.
Yeah, I agree as a patient. From the patient perspective, when people open your chart and it's a new doctor or something and they know all your past, so you don't have to keep talking about it. And also I would say sometimes as you get a little older, sometimes you're like, oh yeah, that did happen to me. Oh yeah, that did. Thanks for reminding me.
Yeah, exactly.
So I know that we want to be respectful of your time. So we're kind of nearing the end, but I do want to know, how would you advise all of us here to continue through 2023 to live our best lives? Like, what can we do to, I don't know, to spin this around and have as positive as possible 2023?
I've already made my commitment to more dancing, for sure.
Yes. Dancing.
I love that. I was just thinking of that today, actually. I kind of miss dancing, but most people do that after 9 p.m.
I can do 30-second dance breaks wherever I can get them in. But I there is a mountain of work ahead of us, and we're not gonna get it all in one swallow. My my mom used to always say, you shed a mountain one pebble at a time. This is how we move mountains. And so find your mountain, start picking up pebbles, and take dance breaks in between. That's all.
Dance breaks. I love it.
I love it. I'm thinking that, it's too bad you're not on camera right now, because we'd have to show off our individual dance moves.
But I could make a good beat that you and Toni could dance.
Oh, no, that's okay.
No, that's okay. That's all right.
Next time. We'll catch you next time.
Yeah, this is awesome. This is like, I would like to interpret the dance comment to say that just find what it is, whatever it is that you love, prioritize it, and you can get through, prioritize it. And it doesn't have to be for an hour and a half. It doesn't have to be that long. It just has to be that you can have enough touch points with it. And if it's that 30-second dance breaks and you're doing that 10 times a day, that's amazing.
There you go.
That's amazing. So like whatever that is for you, you have to prioritize. Huh?
It's your TikTok side gig.
Okay. Oh my God. No.
Gonna make some money now.
Well, thank you so much, Dr. Nana. We really appreciate you coming to the podcast and talking about your labor of love for all of our listeners, and how COVID shifted everything for you and your team as well. We love having you. Thank you so much for sharing. And
thank you.
Rest of your afternoon.
Mm-hmm.
Thank you. You guys keep doing what you're doing and make people laugh and get them smart about what's going on. I appreciate it.
We're trying.
We're trying.